Alright, so we want to actually look at some another means of trying to classify acute kidney injury, and this means of classifying acute kidney injury to me is quite simple if you follow it logically. So if I'm classifying kidney injuries, I'm trying to look at the blood vessels that bring blood to the kidney. So if there's issues from here down, that's before the kidney, I call this pre-renal. Now if the blood is already in the kidneys, filtering the glomerulus, in the nephrons and all of that, the tubules, if there's issues along that pathway, I call that the issue is now within the kidney. So I call it renal issue or intrinsic issue. It's an inside issue. Now there is this ureter that takes urine away from the kidney. So if there's issues within the ureter, I say that okay, now this issue is after the kidney, so it is what? Post-renal. So basically you use the kidney as a landmark to now classify this. The issue is before the kidney, inside the kidney, or after the kidney. I've explained everything, so let's just discuss. You classify it into what? Pre-renal, intrinsic, and the post-renal. Of course, it will help clinicians to be able to identify the cause, to guide the type of treatment they should initiate. Now pre-renal one, we're saying that is before the kidney, so the blood coming to the kidney if you are having issues there. So possible causes, that's the main reason, could be that what? Blood coming to the kidney, the levels are reduced, so there's hypoperfusion. So what could make blood flow to the kidney reduce? It could be that your volume levels in the body are low, hypovolemia, okay, heart failure or cardiogenic shock. Could be that you have a wide spread of a blood infection, renal artery stenosis. It could be that some drugs that you are currently taking, okay. So key features is often reversible restoration of blood flow, no structural damage, may progress to acute tubular necrosis. So that one, the issue is what? Before the kidney. Let's go to the issues within the kidney now. Same thing, we can pause to observe this picture, right? So issues within the kidney, this one, there's a direct injury to the kidney tissue. Causes could be acute tubular necrosis, could be glomerulonephritis, could be acute interstitial nephritis, could be vascular disorders. So it's just from the tubules getting inflamed, the nephrons getting inflamed, the glomerulus getting inflamed. Do you understand? The blood vessels getting inflamed. Okay, so key features is within the kidney, so the issue is within the kidney. You can see a structural damage to the kidney, may require longer recovery or supportive care. Urinalysis often show cast. You see proteins in urine, you see blood in urine. Then post-renal acute kidney injury. Now the issue has gone past the kidney, the issue is now after the kidney. So of course is the ureters, so there could be blockage or narrowing along that path right to the bladder, even after the bladder into the urethra. Okay, all of that is still post-renal. So for post-renal, it could be urethral obstructions, could be bladder outlet obstructions, could be urethral strictures, could be also have ureter strictures. Okay, so key features, it requires a bilateral obstruction, okay, to cause acute kidney injury. The obstruction must be on both sides for it to become an acute kidney injury. So it's often reversible if obstruction is relieved early. So images, so renal ultrasound is very key for you to now access the anatomy of the kidney and confirm that this condition exists. So that's it for these classifications of acute kidney injuries.